There are currently over 3 million COVID-19 cases worldwide, but according to the charity International Rescue Committee, that number could skyrocket to 1 billion, with the threat of over 3 million deaths if steps aren't taken to contain it. The humanitarian organisation says a more robust response is urgently needed in what it calls fragile countries in the small window of time that's left. It identified 34 countries that are particularly at risk, including Afghanistan and Syria. I'm joined now by Mesfin Teklu-Tesema, head of the health unit at the International Rescue Committee. You're saying here that there is a small window of time. Just how small is it?
Thanks very much for having me. It is very narrow, and the countries that we are concerned or mentioned in the report, they have adopted some sort of control measure, but if control measures are not ramped up very quickly in a couple of weeks, then we're likely to see the worst outcome.
And what sort of countries are we talking about here? You've got a list of 34 nations.
Yeah, we're talking about countries that are conflict affected and who has very weak health system, and also which has underlying humanitarian vulnerability, and many of them are affected by internal conflicts. They are also hosting refugees. Really a complex set of humanitarian situation these countries are facing.
And what sort of actions need to be taken in places like these to stop the things that the IRC is warning about?
So there are a couple of things that need to be done. The countries that are affected have kind of, adopted the same approach that you just mentioned, where, European countries has adopted, which is basically lockdown, stay at home, social distancing. And we know that in our context, in these countries, people are living in a very crowded camp settings, and social distancing is quite a luxury. And also people would have to go out every day to earn their living. So basically for asking people to stay at home is not really realistic in any form. So really, the kind of intervention that need to put in place here has to be context specific in a way that would recognize the existing vulnerability and also at the same time adopt measures that would slow the transmission of a virus and also address the underlying humanitarian needs. So those are the kind of measures that need to be put in place very quickly.
Mesfin Teklu-Tesema joining us from the International Rescue Committee. Thank you very much indeed.